The Leeds Nuffield has a very strong orthopaedic team, and that goes from the wards to theatres. It has a dedicated orthopaedic scrub team in theatre. On the ward, they're very confident and competent at looking after joint replacement patients. They have a rapid recovery programme, which means that patients are able to mobilise and get the benefits of a faster recovery. The standards of care that they're delivering, that's been recognised in the latest CQC report, with them getting outstanding for the care that they give.
We're looking at patients with pain and the kind of pain they have. Is it constant pain, pain on walking? What is their functional limitation? Once we decide on that they need a knee replacement, then we look at certain parameters. We assess the range of movements in the knee, so how much function have they got, because when you're thinking about especially treating young patients with arthritis, we want to retain function. If they've got good function pre-operatively, we want to maintain that function. And if we go straight away for a full knee replacement, they may lose that level of function, because there are different types of knee replacement. So we can more optimize the type of procedure for that particular patient.
Over the last 10 years, there's been increased focus on reproducibility and precision in joint replacement. It's very important that you try and reproduce the normal ligament balance around the knee, in the hope that the way that the knee moves is a more anatomical, physiological movement, and that the knee feels stable throughout that range of movement.
If there is a real-time feedback from the computers within theatres, then one could fine-tune and make sure that it is appropriate for the patient. And that is where I think robotics would really play a big role in being able to reduce the dissection around the tissues, so we can actually minimize the surgical trauma, and also improve positioning real-time while doing the surgery.
The robot, it uses navigation type philosophy along with a CT image of the knee. So it marries up the image platform with what you're seeing in real life. It allows you to put the knee through a range of movements, see what the ligament tensions are, and also to predict from that what the effects of the cuts that you would make would have on that ligament balancing. The robot gives the surgeon choices, but it's the surgeon that makes the actual decision. The balancing, the final decisions, etc. still done by the surgeon. So it's still completely surgeon performed, but it's just with greater insight as to what your decisions are going to do before you've actually committed. Post-operatively, the patient will have physiotherapy, and typically a patient would be mobile with sticks on the first post-operative day. A patient who's working will be looking at returning to work somewhere in the region of 8 to 10 weeks following knee replacements.
It is all about reducing tissue trauma and having a system whereby the patients are informed, pain management is optimal, and then the surgical technique that would allow the patient to achieve that. The additional benefit from that would be that the patients might have less pain and earlier recovery because of less tissue trauma, and by improved positioning, they may feel a bit more natural and have better function with their knee replacement.